here's a question. So, regarding the services and procedures, so would you tell me what all the services that you do provide?
So Phoenix Weight Loss Forever has a multifaceted level of services that we provide. We provide primary chronic disease
Right.
management care. We provide um, mostly weight loss services. We do lab work.
Hmm.
We send people out for acute care issues
Right.
such as sicknesses. A lot of telehealth things can be done as well.
Hmm.
For the most part, we're primary slash chronic disease care management with a major focus on
Right.
weight loss and weight
Got it.
management.
Thank you. And what would you say is the number one misconception patients have regarding your service or about the service?
I think there's not really a misconception of
Hmm.
what we have going on. I think a lot of times people think when you're dealing with weight loss, that's one of the
Right.
major issues that a lot of people come to us for is
Hmm.
for weight loss. So I think
Hmm.
when you're dealing with weight loss,
Right.
the premise behind what is weight loss. You have weight loss from water weight, you have weight loss from
Hmm.
fat, you have weight loss from muscle loss. So,
Right.
our biggest issue is just making sure that people are understanding that we are here to help them lose fat
Correct.
as far as weight is concerned. So, our biggest concerns and focus is keeping, muscle mass
Right.
and staying healthy and eating nutrients and drinking
Right.
water. So, those are some
Right.
of the
Right.
big ones.
Right. All right. And what tip or advice would you give for each service?
Which, say that one more time, please.
No, what tip or advice would you give for each service?
Um, for each service,
Yeah.
when you're dealing with weight loss service,
Right.
the biggest tip that I can give is to drink water.
Right.
And that's 3 to 5 liters of water. When you're dealing with lymphatic drainage, the biggest thing is to be prepared,
Hmm.
dressed appropriately in loose fitting clothes. If you have
Right.
fajas or things of that nature, you need to bring
Hmm.
those. When it comes to regular service, like acute care issues such as chronic disease management, or being just generally sick, being prepared to have IV hydration, which helps out with those acute care illnesses sometimes because most
Right.
people are dehydrated.
Hmm. Hmm. Right. I got it. Got it. And would you brief me through the step by step of what happens from the first visit of the patient, like pertaining to the first visit?
So for most of our patients, we usually like to see them by virtual visit
Sure
first.
visit.
We want to
Right.
see where you are
All right.
when it comes to weight loss. Let's focus in on weight loss. When it comes to weight loss, we want to see you first virtually. The reason why we want to see you first virtually is because we want to make sure that you're a candidate, one,
Hmm.
for weight loss, or are you a candidate for weight maintenance? These are two different things. Some people are trying to
Right.
maintain,
Hmm.
other people are trying to actually lose a lot of weight. So we
Right.
need to see where you are. Secondly,
Hmm.
are you getting lab work? We need to make sure that we get lab work to verify the needs of the person. And then we
Right.
also need to get a feel for you as a person because we need to know that we are able to deal with you medically,
Right.
physically,
Hmm.
mentally, and emotionally. And these play a role into your weight loss process.
Right.
So when it comes to weight loss and Phoenix Weight Loss Forever,
Hmm.
that is the biggest thing. We
Right.
do have the secondary services that we cover,
Hmm.
acute care issues, chronic disease management,
Right.
STI testing, all of that. But our
Right.
biggest thing is keeping you healthy
Right.
and maintaining what it looks like on the inside, not just
Right.
the outside, but the inside as well. So
Sure. And can you tell me a couple of things that a patient should expect during the consultation?
during the consultation, we get nosy. The biggest thing is
Right.
when you have a consultation, it is not your normal doctor's visit consultation. We get
Hmm.
nosy. We want to know you. We want to know about you.
Hmm.
We're here as a team. You're part of the family. We want to make sure that you're losing weight. We want to make sure that you're staying healthy. We want to make
Right,
sure that if you have distractors in your life that we're with you. And we need to know what those are because,
right.
during the course of the time, there may come a time where you
Hmm.
can't do your procedure or you can't come in. So we need to come up with an agreement as to, okay, in the meantime, this is what you can do.
Right.
These are processes because we
Hmm.
never want a person to fall off. You never
Right,
want your family member to get lost. And when
right.
they're getting lost, you
Hmm.
want to be there with them.
Right,
So
right.
we get personal. We want to know some things about you.
Yeah,
And we want to be concerned with kind of keeping a flow of feeling like your family and people who really care about what happens to you.
right. I got it, got it. And what tools or equipment in the office should you show in the video?
So our biggest tool that we have in the office that we use
Hmm.
quite frequently is the
Hmm.
cavitation radio frequency device.
All right,
Our other major equipment that we use is the lipo laser machine,
all right,
and that's the one that's the lights that go on the person. So
all
that's
right.
the infrared lighting that sits on the person for weight loss as well. So those are our
Got it,
major two pieces.
got it.
Our bonus piece is our little sauna that we have,
Oh,
and that
nice.
allows you to back in the days, there was a song, "Make You Sweat, Baby. Let me take control. Let the rhythm move you." So,
Right,
yeah, we going to make you sweat.
right, exactly. I got it, I got it. And which parts of the clinic or environment like camera friendly in terms of like machines, treatment, waiting areas, like the patients you know that like they've been seeing?
So our treatment areas, our major areas at this facility in Woodbridge.
Right.
Woodbridge, Virginia we're a smaller satellite facility in Virginia, so it is a smaller
Hmm.
office. So
Hmm.
we try to make sure that no patient is basically on top of each other. We
All
try to
right.
make sure that when you come in, you're
Mm.
coming in, you're checking in, you're going straight to your procedure area.
Right,
We try we our goal right because our office is smaller. Our goal is not for people to sit in the front areas.
right, right.
We rather you go into each area that you're supposed to be in for your services and your treatments.
I got it.
Hmm.
All right. Thank you. I guess this wraps up the questions that I had.
All right. Well,
All
it
right.
has definitely been a pleasure speaking with you on today.
Pleasure's
Happy.
mine. Yeah.
Again, I'm Taishambe, the nurse practitioner
Nice to
for
meet you again.
Phoenix Weight Loss Forever. It's been a
Hmm.
company that I have enjoyed working with over the past 4 years,
Hmm.
as I myself have lost upwards of about 60 pounds through the company. So I appreciate everything
Right,
that the company has offered me as a
right.
provider. So
Mhm.
thank you for your
Thank
interview.
you. All right, thanks. Bye.
All right. Thank
Bye.
you. Bye.